For as long as I can remember, the smallest decisions, grades, and competitions would send my brain spinning like a top, muddling my thoughts until my dizziness overtook me. At the time, all the pressure I'd been feeling felt like it could never be managed. Then I read The Happiness Track by Dr. Emma Sapala. She provides research showing how anxiety is created, how it affects the human brain and body, and how a stressful situation can be replaced by happiness. Her book made me question how many other people are in need of help without realizing their obstacles can be overcome. After looking through many studies and data, I felt the most important information to research was how people can manage their anxiety in a way that allows them to function independently in society. This led me to my research question: what are the most effective anxiety reduction strategies for American teenagers? After my research, I was able to develop an answer to my research question. The most effective anxiety reduction strategies for American teenagers are acceptance, different combinations of mindfulness, and medication. The first step to getting support for children with anxiety is acceptance through therapy. Christy Dalrymple, a licensed clinical psychologist who had her research shown in the textbook Advances in Psychology Research, describes how the process is implemented by stating the overall aim of acceptance and commitment therapy is to change one's relationship with thoughts and feelings by attempting to increase willingness to experience them fully without defense while simultaneously pursuing personally valued goals. Therapy teaches adolescents about anxiety by talking about stressful situations and self-monitoring homework assignments away from their therapist. Dwight Evans explains how these tasks allow the child to learn about anxiety and, more importantly, the cognitive, emotional, and behavioral aspects of his or her own personal anxious experiences. These sessions allow the child to begin to think about various ways to overcome his or her anxiety. This shows that if a child does not understand and accept why they have an anxiety disorder, it is almost impossible for them to overcome the hardships they face. This is why acceptance in therapy is such an important first step in reducing anxiety. Equally important, while the adolescent is going through acceptance, he or she also needs to find ways to reduce the anxiety they feel through mindfulness. It is a way to focus one's minds on their thoughts, feelings, and senses in the present moment. Camila Dvorica, who is a PhD in Human Development and Family Studies at Penn State, wrote the article titled Promoting Healthy Transition to College Through Mindfulness Training with First-Year College Students, Pilot Randomized Controlled Trial, in which 109 U.S. college freshmen would attend a mindfulness program to help reduce their stress from their first year at college. The study was used to find how effective mindfulness is on stressful students. Dvorica found that attending the mindfulness program in the first semester of college led to significant improvements in the students' life satisfaction, depression, anxiety, sleep issues, and alcohol consequences in comparison with the control group. This proves that young adults who practice mindfulness have less anxiety and overall a better quality of life. Overall, those who practice mindfulness experience a significant decrease in anxiety. Finally, the last method to help decrease anxiety in adolescents is medication. Dr. Rosario Hidalgo, a board-certified psychiatrist who received her medical degree from the University of Buenos, is the author of Social Anxiety Disorder in Review: 2 Decades of Progress, a research article showing the effects of medication on anxiety. In her study, 65 patients received 12 weeks of treatment on phenelzine. She found that the phenelzine patients experienced a 79% decrease in the mean Liebowitz Social Anxiety Scale score at the end of week 8, and further improvement was noted after the further 8th week of treatment. This shows how medication does help improve people's mental health. However, the study was conducted with adults and not only teenagers. This is a result of lack of studies on adolescents taking medication for mental health issues. Due to this, teenagers need to try to vary the techniques that they have to find the combination that works best for reducing their own anxiety. After my research, I have found the most effective ways to help people with anxiety symptoms were medication and forms of mindfulness. While researching this topic, I have been able to learn a lot to benefit my own mental health. I now practice these techniques on my own, knowing how to utilize them to their full potentials. Furthermore, this paper has also taught me about the research process. In the future, I will change the way I make my note cards by having an open mind to all the information I find, instead of only looking for data that supports my claim. While working on this project, the hardest part was looking through many books to try to find the evidence I needed. On the other hand, I felt very comfortable putting all my note cards together and creating the final iSearch. Now, instead of letting my anxiety disorder control and limit the way I live my life, I am able to go through life on a happier